Perfect. So you can go ahead and take us away.
Okay, hi guys. My name is Anithra, and I am a first year student here at the University of Calgary, in the MPAS program. So me and Jayden are just going to do some quick introductions here before we hop into it. So I'll just talk a little bit about our backgrounds, what we did before we started PA school, and also why we decided to be a PA. So for me, I did my undergrad at the University of Waterloo in biomedical sciences. I then went on to do a master's in health science at Western University. And my two main healthcare experiences I had was the first one was I just worked at a COVID-19 vaccine clinic. And then after that, I worked as a medical office assistant at a rheumatology clinic for a couple years before I came here. In terms of why I wanted to become a PA, I really like the fact that PAs are able to kind of help fill a gap in the healthcare system. I know for me and my family, I haven't had a family doctor for a couple years, and that's a really big barrier to healthcare, and I know that's a big problem that many people face across Canada. Also for me, when I worked in a rheumatology clinic, because I was working for a specialist, I really got a sense of just how difficult it is when patients have to wait a really long time to see both specialists and generalists. So we had really long wait times to see the rheumatologist that I was working under. And then even when we had to refer our patients out to other specialists, they had to wait a really long time. So I think that had a really big impact on me and how I see healthcare. And I really like the fact that PAs are able to kind of fill in the gaps, help reduce those wait times, help doctors out by increasing the number of patients that are seen. So that was kind of my main motivation for why I wanted to become a PA. Now I'll hand it over to Jayden for her introduction.
Awesome, thank you. Hi guys, my name is Jayden. I'm a first year student at University of Calgary MPAS program here. So a little bit about me. I'm from Manitoba. I did my undergraduate degree at the University of Manitoba, and my major was in genetics. My minor was in chemistry, and all of my previous healthcare experience was mainly volunteer. So I worked with Learning Disabilities Manitoba, a swimming lead program to help children swim that have disabilities, as well as working at Cancer Care Manitoba and working as a child life specialist. I also did a lot of volunteer work with community programs, teaching children dance and cheerleading, and that was majority of my experiences working with patients and youth. For myself, the reason why I wanted to become a PA was actually more of a family personal experience. I became inspired when I had a situation with my younger sister who ended up being pretty ill with a lifelong condition. And the care that she received alongside a PA was just incredible. And that's where I saw firsthandedly what a PA would do and how they would increase access to care and how they have more of a voice to help patients feel heard and help advocate for their health. And that was something that's really important to me, and it really changed the care that she received. So from then on, I really wanted to get involved in this profession. And from there, just volunteered and gained some shadowing experience from other PAs in the city. And I fell in love with the career. And I'm excited to pursue it moving forwards.
Okay, so I'll just do a quick overview of what we're going to be talking about today. So I'm just going to start off with a quick program overview, sorry. And then Jayden is going to go into a day in the life and also a bit about the program structure. And then I'm going to finish off with admissions. And then after that, we're going to go into a Q&A session where we can try and answer your guys' question to the best of our ability. Okay, so first I'm going to start off with an overview of our program. So first, I'm just going to start off with reading off our mission. I'm just getting this straight from our website. If you just Google like University of Calgary MPAS program. Our website has a lot of really good resources. If there's anything that you missed during our presentation, or if you want to follow up on it later, there's lots of important dates and stuff on the website as well. So I'll just start with the mission here. So the Master of Physician Assistant Studies program at the University of Calgary aspires to empower students with essential knowledge and skills, fostering an inclusive community of collaborative and compassionate physician assistants. Our mission focuses on lifelong learning and ethical practice, aiming to advance structural competence and diversity in healthcare, ultimately preparing graduates for transformative roles in the evolving healthcare landscape of Alberta and beyond. So in terms of the overview of our program and the timing and how it works, it's pretty similar to the other PA programs across the country, if you're familiar with that. So our first year is just a didactic year. So we are in school learning about how to PA and just get kind of making a good foundation for what it's like to be a PA. And then our second year is all rotations. So in first year, we have 3 courses. So it's fundamentals, foundations, and clinical skills. And we do that all throughout the first 12 months of the year. And Jayden's going to get a little bit more in detail with that when she does her section. And then in year 2, we do our electives. So we have the mandatory electives that are just right here. So with the first one is urban family medicine, rural family medicine, internal medicine, pediatrics, obs-gyne, emergency medicine, general surgery, and psychiatry. And then we also have 2 4-week elective rotations, which I believe are going to be at the end of our rotations to the last few months. And then after that, we'll graduate and we're going to be able to challenge the National PA Certification Exam, which means that we're able to qualify for registration with the College of Physicians and Surgeons of Alberta at the end of our 2 years. I'll pass it over to Jayden and she can start with the day in the life.
Perfect. Thank you. Yeah. So I'm just going to run through, I guess, a day of my life as a PA student. I'm going to kind of start with the weekend because I think it's a lot easier to discuss in terms of like what I would do on the weekend to prepare for the week moving forwards. So usually my Saturday consists of actually taking a day off from school if I'm able to, unless there's some really heavy readings that I need to get done. I also work a part-time job, so I do that on a Saturday, get all my errands done, do my cooking for the week because I don't have too much time for that throughout a busy week. And then my Sunday is just a heavy day of reading to prepare for any classes that we have on the Monday, and then our clinical skills on Tuesday as well. Okay, so I guess this is just a summary of my everyday. So usually I'm a morning person, so I'm up around 5. I have my morning coffee and I head to the gym. And then after that, I try to get to the library by about 8:30 and do some studying at the library beforehand just to prepare for example, on Monday, the morning session, or on Tuesday to review anything that I learned on Monday. And then around 10 o'clock, that's when we have our either foundations on Monday, Wednesday, Friday, or clinical skills. From there, we get a little bit of a lunch break. And then we have our afternoon, which will consist of foundations Monday, Wednesday, Friday, or our small group learning on Tuesday, Thursday. And then after that, my general school day is done, but I'm either at the library or at home, usually studying about 4 to 5 hours at night and just preparing for the next day. Okay, so then a little bit about the organization of our schedule. So our Monday, Wednesday, Friday, we have our PA fundamentals. So that's going to be our morning. And then our afternoon is going to be our foundations of practice. And then Tuesday, Thursday are our days where we have a little bit more hands-on and a little bit more interactive with small groups. So our clinical skills or sim lab will be in our morning. And then our afternoon is consisting of small groups again. Okay, perfect. All right, and then moving on to kind of diving deeper into what each class is. So our fundamentals is kind of our overarching class where we're learning all of our anatomy, physiology, treatments, diagnosing from various professors, doctors, PAs, other allied healthcare professionals. It's really nice because every single week we get introduced to new people that are experts in their field. We really gain some super knowledgeable materials, and we can ask them specifics about their field, which really enhances our learning. There's also a large focus on the social factors and challenges that patients as well as healthcare practitioners that we're going to face within the healthcare system dealing with these issues. All right, and then moving on to our foundations. So this class really focuses on what it's like to be a PA and everything that encompasses that. So we learn about the history of the PA profession, how it came to be, what it is currently now, and practicing as a PA, what we're going to be walking into when we're done our training within the 2 years. We're going to learn about the current standards as well as what we can and can't do as a PA, which is incredibly important to learn before heading into that profession. And then there's also a large focus on ethics. So we learn about social and structural determinants of health that shape our healthcare and shape health in general within Canada here. We learn about ethical complications that are going to arise for us within a healthcare setting, how to work through that, how to navigate through challenges. And I find that this course is incredibly valuable because there's a lot of barriers in healthcare that we don't learn unless we're taught them. And then the final piece of this is that on certain weeks, we actually get this class time where we get to shadow either PAs, allied healthcare professionals, or MDs, which I think is something that's really unique to our curriculum here, that we get to do this right off the bat, which is really awesome because we get to find a field that we may really like super early on and then make connections moving forwards. And then you get to apply the skills that you learned from a few weeks ago in practice alongside shadowing a different healthcare practitioner. All right, and then moving on, our simulation lab, that's part of our clinical skills. But basically what a simulation lab is that whatever we're learning for that week, we'll come in and we'll have a simulation. So some people will be taking a history, someone will be doing a physical exam, and then we'll be presented with a case with our professors that are, I guess, holding the case or facilitating the case. They will read it to us and then they'll say, okay, I'm going to be this person, I'm going to be the patient. And then we just go into it as a team and we work through the case together. Some of them are a little bit more high fidelity, where it's acute care and we're really trying to figure out things in a very quick manner. Some of them are a little bit more chronic care and discussion based. But this really enhances our learning because with a lot of things, you don't learn them until you do them. So this is our way to see how things would be like in real life. And then as well as in that sim lab time, if we're not having an actual simulation lab, sometimes we'll have that hour or 2 hour block to practice given skills. So we'll have a lab teaching us how to suture, which was what our week was last week. Our Thursday morning session was focusing on suturing, injections, and abscess drainages. All right, and then clinical skills. This is what we usually have every Tuesday, and we start off by having a general group discussion about our readings from the weekend. And we'll say, okay, what did we learn? What were the red flags? What are we looking for in a given disease presentation? And that allows us to kind of collaborate, bring all of our heads together, and we are able to learn from each other. And then after we do that, between the five of us in our group, somebody's going to be assigned to take a history, somebody's going to be assigned to take vitals, someone's going to be assigned to do a physical exam, and then somebody will be taking a scope note and someone will be documenting. And we will be working with a standardized patient, and we go in and we do everything that I just spoke about. And then from there, we'll have the standardized patient come back in and debrief with us how we did. So, how we made them feel, how the exam felt, which is really valid for our learning because then we get to learn every single week different skills and different approaches that we can alter to then improve the next week. And lastly, we also have small group learning. So this is our Tuesday and Thursday afternoons, where again, focus on our focus of the week. We're given a case ahead of time, but it's going to have some limited information. And then from there, as a group, we come in and we read through the case together. And then we go through what we need to do. So how we would take a history, what are different complications, what do we want to do for ordering labs, and what's on our differential diagnosis. And these cases are pretty complex, so it allows us to really enhance our learning from outside of what we were taught that week. Because a lot of us come from different backgrounds, so we're able to bring in different pieces and collaborate together. And I find that these sessions really solidify a lot of our learnings and our fundamental classes. Okay, and then I'll hand it over to Anithra for admissions.
Okay, thanks, Jayden. So yeah, I will just do a quick overview about the admissions. And again, I think our website is actually really good resource just to remind yourself of all the admissions requirements, but I'll go through them here today. So the first one is you have to be a Canadian citizen or permanent resident or have refugee status in Canada, which I think is consistent with all of the rest of the PA programs across the country. You need to have a 4-year undergraduate degree. There's no specific kind of degree that you need. It doesn't really matter if it's like a science degree or something else. There's just 2 courses that you need that I'll talk about in the next slide. But yeah, just a 4-year undergraduate degree. Minimum GPA is a 3.2. So this is just a minimum GPA that would send you into the next stage, or that would get you past the first screening stage of the admissions. And it's calculated over the most recent 60 units. So with the 60 units thing, this was also something that I was a little bit confused about when I was first applying to U of C, just because in every university, the way that courses are kind of written on your transcript is different. So the way that it is at the University of Calgary is every course is like 3.0 units. But at my university, which was Waterloo, I think this is also across like a bunch of Canadian or a bunch of Ontario universities at least. We look at it in like 0.5 units is one course and like 0.25 is a lab. So in that case, I believe it would be across the most recent 10 units. But basically the most 60 units basically just means like the past 2 years. So it's your 2 most recent years of your undergrad that minimum GPA needs to be completed by. Next is the English language proficiency. And then we also have prior healthcare experience. So this could be work experience, volunteering, clinical placements, etc. I can maybe speak to some of the healthcare experience that we have in our class. So as Jayden said, she did a lot of volunteering. Me and Sonya were medical office assistants. And then I worked in the COVID-19 vaccine clinic, and I also did a little bit of volunteering before that. We have a couple of paramedics in our class. We also have a respiratory therapist. We have a nurse. We have a kinesiologist. And other people that did different kinds of work experience and also volunteering. I would say the most important thing here is to try not to compare yourself to other people when you think about, or when you look at other people's prior healthcare experiences. So you might look at somebody else and think that they have like thousands and thousands of hours. And I know that might seem a little bit overwhelming. But I know for me, I didn't have tens of thousands of hours like some of my classmates might. So I would just say don't count yourself out of the race just based on the number of hours you have. It's more so about what you got from the experience that matters the most. And there's lots of things that you can do to get this prior healthcare experience. You don't need to like look at what other people have done. Find something that you think is the most interesting to use, what I would say. The next thing is the two references. So it's just a reference form that they have to fill out, and they must have directly supervised, managed, or overseen you in any kind of capacity. So that could be somebody like your manager, or maybe your boss, or if you're doing volunteering, maybe like the volunteering coordinator, just somebody that knows you well. I would say with the references, a question that I get a lot is kind of like, is it better to have somebody that has like a nicer sounding title? So for example, like would I rather have a doctor give me the reference versus somebody who maybe might know me better but doesn't have a fancy sounding title? I would say the most important thing is somebody that's able to speak to your personality and your experiences. So I wouldn't get too hung up on like making sure that I have a doctor who has my reference because I don't think it really matters. I think as long as somebody knows you well and is able to speak positively and really knows your attributes well, that's probably the best reference you can get. And then the last thing is the essay. So it's just a 500-word personal statement. I think the most important thing here is to get your essay read by multiple people. So ask your friends and family. I know for me, I tried to ask some of my friends that were not in the healthcare field. So my best friend is an engineer. She knows nothing about healthcare. So I just wanted to make sure that my personal statement made sense to somebody that doesn't have all the context of like what a PA is the way that I would. Because I think it would make more of an impact if your essay makes sense to like the most amount of people possible because you never know who's going to be reading your essay. So just get it read by your friends and family and really anybody you can just to see, get more input because sometimes we kind of have tunnel vision when we're writing our own essays. And I know I did when I was writing mine. So it was really valuable, I think, to get other people's input on it. Okay, these are the other prerequisites. So this is what I was talking about before. So it doesn't matter what undergrad degree you do, but you do need to do human anatomy and physiology. So it's the completion of the human anatomy 3.0 units and human physiology, also 3.0 units at a post-secondary level with a minimum grade of a 3.0 on a 4.0 scale. I know not all universities use a 4.0 scale on your transcript. I know mine didn't. So what I just did was search up like the OMSAS GPA conversion. It's just something that you can search up online and it basically has, I think this is Ontario specific. So Jayden, you can hop in and tell me what you did. But if you're from Ontario, I'm sure there's like an Alberta equivalent too. You can see all the Canadian universities and see what your grades could translate to on a 4.0 scale. That way, you know how to calculate it and you can see if you met the minimum 3.0 threshold or not. So the next thing that we need to do is the Indigenous education course. So if you're offered admission, you're required to provide proof of course completion by the start of the program. So this is just a free Indigenous education course that you can do online, and you only need to do this if you're offered admission, so you don't need to worry about this during the initial parts of the application cycle. This is just something that you need to do before the beginning of school. So me and probably, I think the rest of all of my classmates kind of did this just like the summer before. It doesn't take too long, but it's just another thing to remember to do. And then the last thing is Casper. I'm sure you guys have all heard about Casper, but it's the online evaluation that assesses non-cognitive skills and interpersonal characteristics that are important for success in the MPAS program. The only thing I think you need to remember here is that there's only like certain dates that you can do the Casper on. So just making sure that you get onto the Casper website early, and just seeing what dates are available. I think on the website or on the U of C MPAS website, it said that the last day that you can do Casper, I believe, is January 25th or like sometime around the end of January. So just making sure that you don't miss that deadline because Casper is a super important part of the application and something that needs to be done during like the initial stages. Okay. So the next thing are the parallel admissions pathway. So there's the equity admissions pathway and then also the indigenous admissions pathway. Basically, these are just like alternative pathways that you can take when you're doing your application. So I'm just gonna take this from the website here. So the equity admissions pathway is designed to provide a platform for applicants from historically underrepresented communities to share their unique perspectives and experiences. So this is for applications who are members of equity deserving groups, including but not limited to visible/racialized minorities, individuals with disabilities, LGBTQ+, those from rural and remote communities, and those facing socioeconomic challenges. And they're encouraged to apply through this pathway. And then the Indigenous admissions pathway are for applicants that self-identify as First Nations, Métis, or Inuit. And if you are applying through either of these pathways, you also have to write a 500-word essay describing your identity, connections and affiliations with the identified communities, and reasons for wishing to become a physician assistant. It's kind of a similar thing to the 500-word personal statement that you would be writing anyways, but this one is just a little bit more tailored. And then if you're writing this 500-word essay, you don't have to write the one that you would be writing if you're just going through the regular pathway. I think one thing to note here is that even if you are applying through the parallel admissions pathways, you still have to make sure that you're hitting all of the other requirements that are mentioned before. So it's still the same GPA, still need two references, still need to apply to, or still need to do the Casper. So people that are applying through this admissions pathway don't get any like special circumstances. It's more just like another way of admitting just to show more about your application. Okay, so here I'm just going to talk about the application review process. So the first step is administrative review and screening. So this is kind of what I was talking about before when I was talking about the GPA requirements. So this is kind of like the first screening steps, just seeing if your application is complete. So basically, if you have the minimum 3.0 GPA, if you've done the Casper on time, if all of your references have been submitted, this is just making sure that all your ducks are in a row basically for the application process. And then if you have completed everything that's required for the application, then we would move on to comprehensive evaluation. So this is when the admissions team is kind of taking a more detailed look at your application. So everybody that goes onto this part of the review process would have all the basic requirements for admission. So this is kind of when they're taking a deeper look, maybe looking at GPA more competitively, reading more deeply into the personal statement, just trying to see which applicants have the qualities that they're looking for. From there, we go on to interviews. So this year for us, it was an online interview process, and it was kind of like an MMI, which is a multiple mini interview. Again, this is consistent with what the other PA schools do as well. So you just kind of go through stations with different questions and different people evaluating you. Um, and then after that, they just take all of the data that they gathered from the interviews and also all the data that they gathered from the application that you submitted to do a final review. So out of the people that do the interviews, they go on to do the final review, and then they pick the top 20 people, offer them admission. And then there's also a wait list. And then, yeah, that's pretty much it. This is our Instagram here, so you can give us a follow if you want to keep up with us, and then also our Facebook. And then that's also Anne at Canadian PA, who I'm sure everybody knows. Okay, so now we're just going to hop onto a quick Q&A. I think Sonya is also going to be joining us. So if you have any questions for the three of us, we're happy to answer and we'll do our best to answer your questions.
Okay, hi everyone. My name's Sonya. I'm also a first year PA student at the University of Calgary. So I'm going to be monitoring both the Facebook as well as the Zoom chat. So you guys can start sending in your questions and I'll just say them out loud and you'll get an answer from any of us. So we already got one question. So this is from Facebook. Are you writing two essays, two 500-word essays, if you decide to apply through the parallel admissions pathway?
So no, it's just one essay, but if you're applying through the parallel admissions pathway, your essay is just going to be a little bit more tailored toward the questions that they're answering. Whereas if you're applying through the regular stream, it's just a more general personal statement. So it's just one essay, no matter which pathway you apply to.
Okay. We have another question that says, how much does the PA program cost yearly?
I can take that one if you guys. So currently our tuition is about 20K a year. And then that's just tuition alone. And then, yeah, I believe it's also like around 20K for the second year as well. So around 40 Canadian in total.
Perfect. So our next question is, if you graduate in Alberta, can you practice in other provinces? So I can go ahead and answer this question. Both Anithra and I are from Ontario, and then Jayden's from Manitoba. So if you graduate from the University of Calgary, you can practice in any of the Canadian provinces or territories. You just have to make sure that PAs can actually practice there, which is increasing all across Canada, which is great. The next question is, what sort of experiences did each of you feel helped prepare you for this program? This is like a couple part question, so I'll start with that one. I don't know, Jayden, you want to take this one?
Yeah, sure. So I think for myself, what I found was most beneficial applying to the program was just gaining as much experience as I could in different fields. So I was with Ronald McDonald Health, where I gained a lot of experience working with a lot of families from rural areas in Manitoba that weren't able to get great access to healthcare when they had little ones that were sick. So this really allowed me to gain a lot of knowledge on their social factors that really inhibited them having great access to healthcare. I also thought it was really great to gain experience in working with different populations. So within cancer care, I was able to get some patient facing experience with parents as well as little kids, as well as elderly patients. And I was also able to really see how the healthcare team works between the nursing staff, the MDs, the PAs that worked on the unit. So I feel like gathering multiple experiences really helped me. I think also I had some research experience as well that helped me with my application too, just because I had to do a lot of reading and writing that I thought really helped me prepare for it.
Okay, perfect. The next part of the question was, what do you think were valuable experiences that prepared you for your studies?
I think it's kind of like the same sort of question, just to like jump off of what Jayden said. I kind of agree with just trying to get as much exposure to different fields as you can. So for me, I started off with volunteering in a mammography department and I was in a hospital. And then when I did the vaccine clinics, I was kind of like out in the community. And then the rheumatology office was also like a community, really small clinic that was not in a hospital. So I think just being able to see how healthcare works in different settings is really helpful, especially because as a PA, we're able to work in all kinds of settings. And also for our second year rotations, we're going to be in different settings for every single rotation. So it's good to kind of have exposure to that. I think for me also, like in my rheumatology clinic, I was working really closely with the doctor. And I think just having a really good understanding of what it is that doctors actually do, just because I think there's a lot of people that kind of glorify medicine or like go into medicine not exactly knowing what doctors do on the back end. I think there's a lot of back end work that happens that patients might not see. So I think for me, that was really valuable because I could see, like, as a PA, how I'd be able to help offload this work for the doctor, and also just the types of things that I would also be participating in as a PA. For example, like I didn't even realize how much charting goes, or how much charting a doctor really has to do, and that's something that we also have to do as a PA. So it's good to expose yourself to that early on.
Perfect. The next question is, may I ask how you felt you were able to separate yourselves from other applicants? I can
Okay.
jump in on this one. Oh, go ahead, Jayden.
Okay. I was gonna say maybe we could all like share our experience,
Yeah.
but one thing I will say is that every single person in our class is so different and so unique. So I think any experience that you have is extremely beneficial, and never count yourself out just because you don't think your experience is super valuable. I know that going through the application process, it can be pretty stressful. And I remember that thinking like, I don't know if my experience is valuable, but everything that you do has value to it. So just remember that. But for myself, something that I really focused on and I thought was valuable for my application was I actually grew up in a small town. So I had a lot of experiences working within a smaller community. So I was really able to see how healthcare differed from a really small town compared to where I went and did my university degree in Winnipeg, which was a bigger city. Um, and just comparing the two, it was very, very different. So I think having that knowledge and that experience in the different two settings really helped me with my application, because rural health is something that I'm considering. So that's one aspect that I thought I really focused on.
Yeah, I think another thing I wanted to add on is because I also applied to the Ontario schools, is it's really easy to get caught in the demographics. Like previous applicants worked as a medical assistant, had a 3.6 GPA or whatever. It's really easy to get caught in that. And you want to remember that you don't want to be a cookie cutter applicant. You want to make sure everything you're doing is because you're actually interested in it and you have a passion for it. And that'll help you stand out more as an applicant than following what everyone else is doing who's applying to the program. So really think about like the healthcare experiences that you want or who you want to ask for your references and so on and so forth. I don't know if you want to add anything, Anithra, before we move on.
Yeah, the only thing that I can think of that you guys didn't touch on is kind of maybe how to stand out for the interview process. So I think for me, because all of our interviews, well, not Manitoba, but I think most of the other PA school interviews are online. Kind of just getting used to talking to a camera. I know for me that was something that I kind of struggled with. I'm really used to like talking to people in real life, and I found that interviews in real life were way easier to me just because it felt more natural. And also I know for some of the admissions process, sometimes you're talking to like a blank screen, so it just feels like really awkward. Something that I did that I think really helped me a lot was really just like practicing with one of my friends. So she would just search up like basic interview questions for like PA school. That's something you can just Google, and there's like tons of questions online. Just practicing them and just getting comfortable in front of the camera. I don't think it's good to like memorize answers or have like a very like cookie cutter answer for everything that you say, but just getting comfortable talking in front of the camera and really letting your personality shine through, just because they don't want a class of 20 people to be like the exact same as one another, right? Like Jayden said, everybody in our class is really unique. So I think just like honing in on the things that make you you and what make you like special really make you stand out, because that's what really makes you different from everybody else, and just being confident in what you are and the things that like make you different.
Okay, perfect. So the next question is, since this is the first year of the program, I imagine there have been some bumps. Would you be able to comment on the aspects of the program that feel a bit rocky right now, or what you hope will be different for next year's students? So I think this is something like I could touch on a little bit. Just like every PA program, I don't think it's just because the University of Calgary's first program. I think every PA program will have bumps along the road, and it's more so how you choose to manage them. I know for me, throughout my undergrad degree, I really like dreaded doing pre-readings. And so with this program being assigned the amount of pre-readings that we are every week, it was something really difficult for me to like get used to and start preparing for. So I wouldn't really speak on the bumps of the program, but more so what I can do to be successful in the first year of this program. I don't know if you guys have anything else to add on to it.
Yeah, I think for me, because we are the first year of the program, this is like the first program even in all of Alberta. Many people in Alberta might not know what a PA is, and I know that that's not exclusive just to this province. Even like being from Ontario, even though we have two PA schools, people always kind of think that like, oh yeah, everybody in Ontario knows what a PA is, but that's not true in my own experience. So this is just something, I guess, even just pursuing the PA program that might be a little bit of a bump, and just something to expect is just the fact that like people might not know what you're doing. But I think it's actually kind of cool that people don't know what I'm doing, because then I get to explain it and it's something that I'm really passionate and happy to talk about. So I think it's actually a really cool experience that I get to let people know about it, and I get to tell people how we're going to change the landscape of healthcare in Ontario. But that's something that might be a little bit of a challenge, especially since it's a question that I do get a lot.
Do you want to add anything, Jayden, before we move on?
Yeah, I was just kind of going to tag off of you there, Sonia, but I think that's something that our program, of course, every program is going to have bumps, especially when starting off. But something that our directors are really great at is taking all the feedback that we have and applying it. So we have had multiple sessions where they're just asking how things are going, what's going well, what's not going well, and then they really care about us a lot. So they're really working through any complications that come up. And I think, like you said, that's what matters most. It's not about like where we are, but it's about how we're addressing that and how we can be better. And then we have such a wonderful team that really is pushing and striving for that, which I think is the most important part.
Yeah, for sure. The next question is, may I ask if Canadian PAs can practice in the US? I also applied to American PA school, so I don't mind answering this. The short answer is no. Canadian trained PAs cannot work in the US. If you are a Canadian and you decide to go study in the US, you can come back and practice in Canada and also practice in the States. But if you choose to do your PA studies in a program in Canada, you can't currently practice in the US. We don't really know if that's changing in the future, but that's the short answer. The next question is, what support services are available to MPAS students, such as academic advising and mental health resources?
That is a great question. In terms of mental health resources, I know that we have, since we're under like the graduate school and we're also under the Cumming School of Medicine, everything that, or most things that the med school students have access to, we also have access to in terms of mental health and resources. And then in terms of academic advising, because we're a really small program, we kind of get to know our program directors and everybody that works on the admin side really, really well. So every single one of us, every single one of them knows us by name. So although we don't have like a very formal academic advising service, just because there's only 20 of us, I think that they do keep up to date with everything that we're doing academically. And I know that I can ask like any one of them if I'm having any issues with academic advising. I'm not sure exactly what you mean by academic advising, just because we don't really have like we have a set schedule and we kind of just like stick to it. We can't really deviate too much off of it. But I know with like people in my classes, if there's any like special supports or accommodations they need, then they're totally able to access that just by talking to our faculty.
Yeah, I think the University of Calgary also does a great job of having like so many different resources, like the wellness center, and then just like really small things that are around the school. Like every Monday, there's like yoga in the afternoons in the atrium. So they really do care about their students, not just our program ourselves, but the Cumming School of Medicine, as well as the University of Calgary in general. The next question is, in clinical skills, do you stay at one? Oh, sorry. It's in clinical. Do you stay at one hospital or visit a few different ones? And do you visit ones outside of the city too?
Yeah, I guess I can kind of tackle that. We're not really too sure yet exactly where we're going to be on our rotations. We don't have that yet because it's not for another year. But I know that for our rotations, we're going to be at the main hospitals around the city, maybe some private ones, but mainly through AHS. And then we do have rural rotations. So they're still figuring out exactly where our rural rotations are going to be. But I know that there's a few students in our class that come from towns nearby and they were wanting to do their rural placements where they're from. And our program director was really keen on that as well. So I think if you're from an area around Calgary, you're welcome to do some rotations of where you're from as well. But I don't think it's really set yet exactly which hospitals we're going to be at, but we will be in different ones throughout the year.
The next question is, how is the Master of Physician Assistant Studies different from the Bachelor of Physician Assistant Studies that's offered in Ontario?
I can take this one if you want. Okay. Basically, the short answer is every person in a Canadian PA school is going to be challenging the national PA exam, regardless of if you're doing the Masters of Physician Assistant Studies program or the Bachelor of Physician Assistants program. So there isn't too much of a difference. It's really just like the degree that we get at the end of the day. Like we can all work the same jobs. We're all going to take the same exam. So I wouldn't get too caught up on like getting a master's versus getting a bachelor's.
That was their follow-up question. And is there a difference with getting just the bachelor's instead of the master's program? I think one difference with the Manitoba program, and Jayden, you could speak on this too if you know more, is that I believe there's a capstone project involved with the master's program. I think our program is still figuring out whether if we're going to have a capstone project or not, but I think that's just like one major difference between the bachelor and master's. The next, oh, sorry, go ahead.
Yeah, no, I was just going to say the Manitoba program, you do a capstone. And I think most people start that in their second year, where you're basically doing a research project and then doing a presentation, which would be similar to kind of like a thesis defense. But I haven't heard if we have one yet.
The next question is, what kind of topics or resources would you suggest we check out while we wait to hear back from admissions in order to help us in our first year if we're lucky enough to get in?
Do they mean like before they
start school? Before they start.
Honestly, like PA school is in a very intense program no matter what school you go into. So I would say just enjoy the time, like your summer beforehand. You can study when school starts. That would be my advice. I don't know if you guys have anything different to say.
Oh, I completely agree with that answer. I don't think there's anything you can really like study or prepare for before you come into the program. Our program is a spiral curriculum, so that means we focus on like one disease or one topic every single week, and we go through them all in the 1 year of didactic year. And so a lot of us, like I haven't touched my anatomy and physiology stuff in like maybe 3-4 years since undergrad. I know there's some people in my class who haven't touched it in like 5, 6, 7 years. You'll be fine without reviewing it. Like you'll be fine. So I wouldn't worry too much about that. Really just enjoy your time before starting school. The next question is, how does this role exactly differ from a nurse and how does it differ from a doctor? I'm trying to understand the specific roles and responsibilities associated with this profession.
I can take this one.
You go ahead.
Go ahead.
Okay.
Okay. You go ahead. I'll jump in if you miss anything.
Okay, sounds great. So I would first start off by saying that a physician assistant is trained under the medical model, where a nurse and a nurse practitioner are going to be trained under the nursing model. So scope of practice is also very different between the two. So the way that we differ from a doctor is that a physician assistant is the extender of a physician's practice. So I will be able to do everything within the scope of practice that the physician I am working under does. So if the physician I am working alongside works in rural family medicine and they do everything that that encompasses, when I'm working alongside them and I am going to see a patient, I would be able to do everything that they do. So take a history, perform a physical exam, order any labs, change or order any prescriptions, and then continue on with the follow up. So I am not the doctor, but I am the extender of a physician's practice. So if any complications arise, or if I ever need to consult with the doctor, they're always going to have the final sign off of everything, because every medication that I would be prescribing would be within their license. And then the difference between, I guess, like a nurse practitioner, like I said, is that they have a very specific scope within like their nursing role, as we have a more general scope within the medical model. I don't know if you want to add anything there, Anithra.
Yeah, no, that was great. I just wanted to add, I think the way that I think about it is that like one big thing with PAs and doctors is we're able to diagnose and treat, and that's not something that a nurse can do. Um, Although nurses are really important for our healthcare system, obviously, as we all know, they're like the backbone of the hospital. It is kind of like a completely different role. So it just kind of depends on how you want to interact with the patient and what you want to be doing in a hospital system or clinic system. I would just think about what you want to do in your job and then choose from there if that's what if you're just trying to decide between like going into nursing or going into medicine.
I'll just add one last thing before we move on is we actually do have a nurse in our program. So if any of you guys or whoever specifically asked this question wanted to connect with her, she is the co-president of our student association. I'm sure she'd be more than happy to answer your questions of like nurse versus PA. So you guys can just message me privately and I can connect you with her. The next question is, any advice for writing the essay? What should we focus on?
I think for the essay, there's not anything in particular that I would say you need to focus on, just because, as we were talking about before, every single person in our program is so unique. We all come from different backgrounds. I know, especially with me and Sonya, a lot of our experiences were pretty similar in terms of like clinical experiences, but even with that, our essays were like completely different, just because we're two completely different people who like maybe grew up in different circumstances, who might like value different things. So I would just say make sure you're writing it in a way that's true to yourself. Yeah, don't try and like look online to see what other people were talking about, because that's not really gonna get you anywhere. And I would just say, like, in terms of advice, kind of like what I was talking about before, just making sure that you get other people to read your essay, just to make sure that it makes sense to another person reading it. Because I know for me, I really got stuck in like the tunnel vision of like what I wanted to write and how I thought it came across, but it might not come across like that to other people. So I think just like getting as many eyes on it as you can would be good, but also taking people's advice with a grain of salt.
Mm-hmm. Okay, perfect. So the next question, as a PA, do you get to kind of choose a specialty, and what would that look like if you choose a field? Would your role change depending on the field you choose? So I can answer this question. You do actually get to work in any kind of specialty that you choose. And the great thing about being a PA is you can switch your specialty whenever you feel like it. So, for example, if you chose to work in family med, then your scope of practice would be whatever a family med physician does and how you'd work in the extension of their role. And then a couple years down the line, if you choose to move on to like ER, then your scope of practice would fall under what an ER physician would do and how you would extend their services. So your role would change depending on what specialty you work in, but you are able to switch specialties throughout your career. And a lot of the PAs that we've actually met throughout the program have switched from various different specialties. The next question, what made you choose University of Calgary rather than McMaster, University of Toronto, Manitoba, Dalhousie, or any other programs within Canada? Sorry, I'll just say all of us here apply to like a bunch of different programs, so we can all like answer
Yeah,
this.
that's what I was gonna say. I was just gonna say, like, I applied to all of the programs that I was eligible to apply for, and I would recommend that you do the same. And then once you do get admission to whatever, then that becomes something that you can think about. I wouldn't focus too much on like program versus program because like I said, at the end of the day, we're all doing the same certification exam and we can all work in the same job. So yeah, I wouldn't stress too much about like which program you're taking.
Do you want to add anything, Jayden, before we move on?
Yeah, I was gonna say I agree. Like, I know I have friends in the U of T program and in the U of M program, and it was the same thing. We all applied to like a few schools, and it was that, I guess, like, which school are you gonna get into? Which one are you gonna get waitlisted on? But at the end of the day, like, I would always take the for sure thing. So for me, like, this is where I was first accepted. I had some wait lists, but I was like, I just want to be a PA. So I'm going to make the move. And here I am. But I'm really happy with my decision.
The next question is, do you have many out-of-province students in this first year class? So I know the three of us are out of province, but there's actually a lot of Albertans in our program. So I believe there is 5 of us from Ontario, one of us, Jayden, who's from Manitoba. There's also one of us who's from BC, and then the remaining 13 are from Alberta, I believe. So majority Alberta, and then there is a couple out of province. Next question. Also just wondering if within this year's class of PA for UC, are there a variety of backgrounds from all students, like some from undergrad, some masters, PhD, and is having clinical experiences mandatory, or would you help your profile to have better chances of getting in? So I think it's a two-part questions.
Yeah, so for the first part, we do have a variety of different backgrounds. So, like I said, I have a master's degree. There's one other student in our class, I believe, with a master's degree. We also have somebody with a PhD. And because we have like people from different healthcare backgrounds, like respiratory therapists, paramedics, they also had to do like additional education on top of their undergrad in order to pursue those fields. So yeah, I think we do have a very wide variety of people from different backgrounds. And then clinical experiences are mandatory. So like I said before in the presentation, it can be volunteer experiences, clinical placements in school, work experiences, as long as it's patient facing. So you don't have to be the one that's actually directly providing medical care to a patient, but it does have to be patient facing experience. So you do have to have some kind of interaction with patients.
Yeah, perfect. Next question, do PAs still need to go to med school if they actually want to be a doctor? Or is there a different route from being a PA to a doctor?
I can take this one. So being a PA and being a doctor are two very different things. So I think that's where sometimes people get confused. They think, oh, you're a physician assistant, you're going to be a doctor. No. When you're a physician assistant, you are a physician assistant, and that is your job. You're not a doctor in training. You're not progressing to be a doctor. If you want to be a doctor, you're not going to go to PA school. You're going to go to medical school, and then you're going to become a doctor. It's two very different roles. PA is not a doctor in training.
Yeah, just to answer the second half of that question, just basically what she said, there's no other route to go from PA to doctor. It's just the same kind of thing that everybody else would have to do to go to be a doctor. You'd start from medical school. So your PA degree doesn't really like change anything about that process.
Yep. Okay. The next question for the Indigenous class, this is not something we need to take in our undergrad, but it's something it's instead a class we can take after getting accepted.
Yeah, so on the website, I think there's actually a couple different options for the Indigenous course. So I think if you went to U of C for your undergrad, there is a specific Indigenous course that if you did take it during your undergrad, you don't need to take the one that we took. But since most of us didn't go to U of C, it was a free course through, I believe it was Coursera. You guys can correct me if I'm wrong. Yeah, so Coursera, it's just a free online course, and it's not like an entire class that takes 4 months like usual, like how a university class would be. It's kind of like an online at your own pace type of thing. And I think it was only like 10 or 20 hours, something like pretty reasonable like that. And you don't need to do it until you get accepted.
Okay, the next question for U of C, is there minimum hours of clinical experience you need to get before applying?
No.
Yeah, that's just a
Yeah.
short answer, no. Okay, so I think we pretty much got to the end of the questions. I guess we could wait 1 or 2 more minutes if anyone wanted to send in any last minute questions. And then, of course, like a previous page, you can always follow our Instagram if you guys wanted to ask more questions, or our Facebook. And then we can also put in our student association email if you wanted to ask more questions after that. Okay, so someone asked me specifically, hi Sonya, what made you decide to go to a Canadian school instead of a US school, knowing the limitations? So for me personally, I actually applied to PA school for 3 cycles, and in my third cycle, which is the cycle I applied to U of C, I decided to also apply to, I think, 5 American schools, and there's actually a couple PAs if you want to go on to Instagram, like Can American PA and some other PAs who are currently studying in the US and are Canadian citizens. For me personally, I had to weigh a lot of things like moving away from home. I know I did move away from home now because I'm in Calgary instead of Ontario. But I think the major factor for me was the tuition cost. So here at University of Calgary, it's around 20,000 per year. And then obviously there's like rent, groceries, and other expenses versus a lot of the US schools I was looking into, tuition was around 100,000. So it is a huge difference. And at the end of the day, that was a big factor for me. So I decided to go forward with applying to Canadian schools. And so if you're okay with paying the tuition and wanted to be able to practice in the US and in Canada, I would go ahead with applying to the US. And there's a lot of great resources on Instagram and a lot of Canadians who are currently studying in the US. Someone asked, how do you find the workload and how do you manage it?
The workload's really heavy, I will say, with any PA school that you go to, because you are learning basically all of medicine in 2 years, but almost like 1 year, because then your second year is a lot of clinical rotation. So it is very heavy. But like we mentioned before, it's a spiral curriculum. So you're always going to be kind of coming back to certain topics, which I think really enhances your learning. And in terms of managing it, I think it's really dependent on the person. Everybody's going to study in a different way. I know a few of our classmates use different services like Anki to help them organize their studies. Cue cards isn't something that works with me. I like to like draw out maps and just that's my form of studying. So everyone's just very different. And I think the first few weeks you really learn how you're going to study successfully for yourself, but it is a little bit of a learning curve at the start, I would say.
Perfect. I'll answer one last question before we're done. Again, you guys can ask more on our Instagram. But then the last question was, how do you guys avoid burnout and avoid not staying up too late and giving yourself rest?
I can answer this one. So I think because we know that PA school is a very rigorous program, it's important to kind of look ahead and make sure that you're prioritizing your self-care and making sure that you're doing things that you find joy in and something that's other than like studying and preparing for classes. So I know with all three of us, we really enjoy going to the gym. That's something that's really important to us. But it's also something that keeps us healthy. So it's important to make sure that we're maintaining those healthy habits while in PA school, because even when we practice as a PA, our lives are still going to be just as busy. It's a lifelong learning career, so it's just something that you have to be prepared for. And I think that keeping those healthy habits while you're in PA school will set you up for success. So I think that's what I would say, just making sure that you have something to look forward to, making sure you're keeping in contact with your friends and family, especially for us, we're out of province. So just making sure that we're keeping constant communication with people back home. That's something that's also helped me a lot.
Perfect. So we're getting a lot of thank yous in. So of course, thank you guys for coming. We really do appreciate it. Just to plug our Instagram one more time, because we'll probably host more of these in the future. You guys can follow our Instagram or Facebook if you wanted to learn more about our program and what we do in our day-to-day lives. And then if you have any more questions, you can just send us